Introduction to Ophthalmology lecture. So, ophthalmology is the science of the eye and its disorders and diseases. An ophthalmologist is a physician who specializes in diagnosis and treatment of disorders and diseases of the eye. An optometrist is not a medical doctor but can perform an eye examination, diagnose vision problems, and eye diseases. They also treat visual defects through corrective lenses and eye exercises. So what is the difference between an ophthalmologist and an optometrist? An ophthalmologist is a medical doctor, so they will have MD behind their name. Medical doctors are able to do procedures on the eye, so surgeries that replace the lens of the eye for cataracts or surgeries to do corrective vision such as LASIK are often common procedures done by a medical doctor. Optometrists are unable to do procedures, and they are mainly for examinations and then to treat and write prescriptions for these diseases and based off of the examinations. Optometrists will have DO behind their name. Opticians are trained to fill prescriptions written by the ophthalmologist or optometrist. They also assist patients in correctly fitting contact lenses and dispensing eyewear. The anatomy of the eye, the sclera is the external protection. It is the white part of our eye, and sometimes this part of the eye will have a yellowing. This is an indicator of jaundice, alcoholism, and sometimes different liver diseases. The cornea refracts light, the choroid supplies blood, the iris absorbs light and regulates the pupil width. This is where we get the color of our eye. The ciliary body secretes vitreous fluid and changes the shape of the lens. The lens also refracts light. The retinal layer has light receptors that transform optical signals into the nerve impulses. The rods and cones that are within the retina, the rods distinguish light and dark and perceive shape and movement, and cones help with color vision. Central foveae is an area of sharpest vision, and the macula lutea is the center of the retina that contains the fova centralis and the area of most highly acute vision. The extraocular muscles help move the eyeball, and the optic nerve is one of the pairs of nerves that transmit the visual stimuli to the cranial nerve, which is the second cranial nerve of the brain, which then goes to the occipital lobe. Lacrimal glands help produce tears, and the eyelid protects the eye. The eyelid blinks about 2 to 3 times per second, and the main purpose of this is to cleanse the eye. So what are the layers of the eye? The outermost layer is made up of the white sclera that protects the eyeball and the cornea that allows light to enter the eye. The middle layer is the choroid, which is the posterior portion of the middle layer of the eye, and it contains many blood vessels that supply nutrients to the outer layers of the retina. The inner layer includes the retina in the posterior portion and the lens in the anterior portion. Here is a picture of the anatomy of the eye. And as you can see, we have our cornea on the outside, and then our pupil, which then goes to our iris. And in the middle, we have our retina and our choroid, and the sclera is the outermost part. Our retina then hooks up with our optic nerve and sends impulses to the brain. Our retina consists of cones and rods. Cones are responsible for color vision, and rods are responsible for light and dark, and shape and movement. The retina is our neurologic center of vision. The vision process. Vision impulses begin with light passing through the cornea. The cornea refracts the light and passes it through aqueous humor and the pupil into the lens. The ciliary muscle then adjusts the curvature of the lens to again refract light rays. Rays pass into the retina, trigger photoreceptor cells with rods and cones. The light energy is then converted into an electrical impulse and is sent through the optic nerve of the brain. The impulse is received in the visual cortex of the occipital lobe of the brain and is interpreted, and a picture is created. There are sometimes errors in refraction. As you can see here, we have myopia and nearsightedness that is uncorrected. Myopia is the lengthening of the eyeball, and patients with this have the inability to see far. And how I remember this is M and N go in order in the alphabet. So myopia is nearsightedness. Hyperopia is the shortening of the eyeball and is considered farsightedness, the inability to see near. Other refractive errors that can occur are presbyopia. Presbyopia is often diagnosed with the Jaeger test. Presbyopia is the changing of the point of focus from distance to near becomes difficult due to age. This is often termed as the normal aging process of the eye. Difficulty seeing at reading level often occurs, and you will hear people use the term "I need readers" to help them with reading. This is often treated with corrective lenses or conductive keratoplasty. And astigmatism occurs when light rays entering the eye are focused irregularly. It occurs because the cornea of the lens is not smooth sphere, but it has an irregular shape, almost like a football shape. This is oftentimes corrected with glasses or contacts, or surgery can be done to reshape the cornea. Other disorders of the eye are strabismus, which is the eyes do not track together, they do not look in the same direction. In children, this is caused by a weakness in the muscle and is sometimes caused by diabetes mellitus, muscular dystrophy, hypertension, and head injuries in adults. Children will sometimes have this due to the lack of muscle development. Infants will sometimes have amyloidopia, which is also called lazy eye in layman's terms. Nystagmus is the constant involuntary movement of one or both eyes accompanied by blurred vision. It is caused by abnormal functions in parts of the brain that control eye movements, and sometimes can develop in patients who have brain tumors or a stroke. Infections of the eye include hordeolums, which are styes in layman terms, is a localized purulent infection of the sebaceous gland of the eyelid. Chalceans are small cysts from blockages of the meibomian gland. Keratitis is the inflammation of the cornea and results in superficial ulcerations. Conjunctivitis, also called pink eye, is the inflammation of the conjunctiva caused by irritation, allergy, or a bacterial infection. Blepharitis is the inflammation of glands and or the lash follicles along the eyelid. Other disorders of the eyeball are corneal abrasions, which are caused by foreign bodies and direct trauma. Diagnosis is confirmed by fluorescent stain and highlighted by a cobalt blue light. Foreign bodies are removed first, then treated with antibiotic ointment and non-steroidal antibiotic inflammatory ophthalmic ointments. Foreign bodies should always be flushed from the eye. They should never be scraped or you should never try to grab them out of the eye. Cataracts are cloudy areas that block the passage of light into the retina. This condition may result in eye injury, exposure to extreme heat or radiation, inherited factors, but is usually due to aging. Blurred or dim vision is a common side effect, and effective treatment is surgical removal of the lens and replacement, or sometimes laser therapy is effective. Here is a picture of a corneal abrasion, and you can see after the dye has been used where the abrasion has occurred. Glaucoma is another disorder of the eyeball which is common and can become serious if untreated, which increases the intraocular pressure. The increased intraocular pressure can damage the optic nerve and cause blindness if untreated. A tonometer and goinoscopy are used to diagnose glaucoma. A tonometer is a very basic test that is done in everyone to determine the presence of glaucoma. This is when you go to the doctor's office and they shoot a quick puff of air at the eyeball to see the reactivity of the lens. Glaucoma is often treated with miotics or beta blocker eye drops, and sometimes surgery will often treat glaucoma too, depending if it is an open angle or closed angle glaucoma. Macular degeneration is a progressive deterioration of the macula. It is caused by severe vision loss and blindness. So what happens is your central vision is blocked, and usually you will see a black blotch in the middle of your vision. You will be able to see off to either side, but you will not be able to see what is right in front of you. There are two forms of macular degeneration. There is the dry, which is about 90% of cases, and then there is the wet, which is about 10%. So here is a picture of the two different types of glaucoma. So the two different types of glaucoma are seen here, and the first one is open angle glaucoma, where the aqueous humor is able to flow and then is usually filtered out through this little duct here. What can happen is this duct can become blocked or narrowed where the aqueous humor cannot be filtered, causing increased ocular pressure and buildup of the aqueous humor. B is closed angle glaucoma, which is much more acute in situation and needs to be treated right away. And this can be a dysfunction in the parts of the eye, and this can be due to trauma, or sometimes this can just happen to patients of unknown cause. And what happens is the aqueous humor, there's a structure in the way of which is normally flow, where the normal flow is, and there is an obstruction to where that aqueous humor is filtered and maintained. Oftentimes this requires surgical intervention.